Can imaging detect all gout tophi in joints? Imagine trying to find tiny crystals hidden deep inside your joints. That's what doctors face when they look for gout tophi. While imaging tools have come a long way, they still can't spot every single tophus in every joint all the time. Advanced imaging methods like ultrasound and dual-energy computed tomography are much better than just looking at symptoms or doing a physical exam alone. But even these high-tech tools have their limits. Traditional X-ray scans can show tophi only in long-standing gout cases. They reveal soft tissue lumps and bone damage, but only when the disease has been around for a while. Small or early tophi often don't show up on X-rays because they're just too tiny or not yet causing bone changes. Ultrasound is more sensitive and can detect characteristic crystal deposits in joints. It's especially good for catching early signs, but very small or deep tophi can still slip past its view. Dual-energy computed tomography, or DECT, is currently one of the most advanced options. It can visually distinguish uric crystal deposits from other tissues without surgery. Studies show that DECT can detect between about 78% and 100% of tophi, depending on how advanced the gout is and how the scan is done. It's especially useful for monitoring long-term gout and checking how well treatments are working. However, in early or acute gout attacks, DECT might miss some small tophi or deposits that aren't yet large enough to be seen clearly. Magnetic resonance imaging, or MRI, offers high detail and can identify soft tissue and bone changes, but it's less commonly used for gout because it's more expensive and less accessible. It's good for complicated cases but isn't the first choice for routine detection of tophi. It's important to remember that no single imaging method can find every tophus in every joint at all times. Factors like how long someone has had gout, the size of the tophi, and the specific imaging settings all influence what can be seen. Small or early deposits often go undetected, especially in the initial stages of the disease. In managing chronic gout, doctors usually combine clinical examination, lab tests, and imaging to get the clearest picture. Imaging helps identify hidden tophi and guides treatment decisions, especially when urate-lowering therapy is used to shrink or eliminate deposits. But negative imaging results, especially early on, do not mean there are no tophi or that gout isn't present. Microscopic tophi can exist without being visible on scans. To sum up, imaging techniques like ultrasound and DECT are powerful tools that greatly improve our ability to detect gout tophi. Still, they are not perfect and cannot find every tophus in every joint. Their accuracy improves with longer disease duration and larger deposits, but early or mild cases may still escape detection. That's why a comprehensive approach, combining clinical judgment, lab tests, and imaging, is essential for effective long-term gout management. Always consult a healthcare professional for personalized advice and treatment options.